Thanks for staying with the Pulse tonight. Concerns are rising about the numbers of daily COVID-19 cases that are remaining stubbornly high and at the very least are showing few signs of tapering off significantly. The test positivity rate is staying between 20 and 33%.
In the last 24-hour reporting period, almost 15,000 new cases were identified. 384 people who've been diagnosed with the virus passed away during that time. The total death toll in the pandemic is now more than 78,000.
There are 158,000 active cases, 5,000 more than yesterday. Vaccine rates, however, are starting to pick up again, with more than 200,000 yesterday.
In the provinces, KwaZulu-Natal now has 50,000 active cases. The Western Cape has more than 35,000 cases.
The Northern Cape has over 6,000 cases, which is quite high for the province with the smallest population.
Mpopo's vaccine rollout still doing well. Nearly 16% of the population there fully vaccinated. And in Mpumalanga, just 6.4% of the population is vaccinated.
Populous province Gauteng has vaccinated more than 12%. Now, earlier today, Cabinet announced that it had approved extending the rollout of COVID-19 vaccines to the 18 to 35-year-old group. Will this improve the vaccine uptake? Well, to answer that question, we're joined by Dr Sibongile Zungu, who is the acting head of Department of Gauteng Health. Good evening to you, and thank you so much for your time tonight. So one of the things that we've known this week coming out of that HSRC survey, the latest survey, gauging vaccine acceptance and hesitancy, it found that the greatest hesitancy is among the population that can now go and sign up for the vaccine, 18 to 34. How are you going to ensure that young people actually show up?
Well, yes, we have seen the study that has come out. And from our side, we are capitalizing on the services that are specifically for youth and adolescents that are available in some of our facilities and also available through some of our partners that are donor funded. And these services have a tact and have strategies to attract young people and have also strategies to communicate in the language of young people. We know that this particular group of people can be impatient, not like the older generations that have a level of patience. So we are catering for those situations where they are not going to be that patient, which is why we have opened all our facilities for the vaccination, and we were expecting that they are going to come into the service on the 1st of September. And we have received the news from Cabinet today that they will be able to start from the 20th, which is tomorrow. And with this, we are then moving all the partners to support us and also opening more sites and pop-up sites in areas that they usually frequent.
What are these services that you're hoping to tap into?
These are usually the reproductive health services, which is what they need, because this is a group that is generally healthy, so their health-seeking behavior is not really high. They do not visit health facilities for anything much than reproductive health services, to get probably contraceptives or to get condoms or to get advice on something. So those services then are what we will be then using to make them, so that when they go there, they can also get a vaccine.
That sounds like just one way of doing it. I mean, do we know the extent of the reach of some of these services? So if you're looking to get the majority of young people aged between 18 and 34 in this province, are you going to reach them by merely using the reproductive health facilities or services?
No. That's not the only method that we use. we have already started opening sites at the shopping centers, at the malls, and they do go to the malls as well. And we do have also some other sites that are outside the non-medical sites, where we have the drive-thrus, where we also have the halls and tents. We have sites that are open everywhere, and we have sites that run over the weekend. And so they have a choice to go to these sites. And fortunately, our vaccine pipeline is quite good now. We are sure that they can get to any site and they'll find the vaccines there as and when they present themselves. And we are also communicating, and our communication machinery has been strengthened to ensure that we cater for this group as well. We were expecting them to come on the 1st, but we welcome the fact that they are coming tomorrow, and we will accommodate them immediately and start getting other demands that will come as they come along. And we are open to take suggestions that come from them. The other area that we are also focusing on, working with the universities, is to ensure that in the institutions of higher learning, we are able to go there, because most of these age groups, some of them are at universities, they are at TVETs, they are at colleges. So we are going to those areas as well in partnership with the universities, colleges, and TVETs.
I'm just listening to what you're saying, and it sounds to me that there's a great deal of reliance on the fact that this population will simply present itself. And yet we know that where people are hesitant, they are unlikely to even be turning up at a vaccination center or anywhere close to that. So how are you going to be dealing with the education that needs to take place, particularly for people who still don't understand why they need to take the vaccine, who still have a great deal of distrust and mistrust in the entire vaccination process?
I think what is important to put forward here is the messages that have been coming out both from the National Department of Health and the Provincial Department of Health around the need to vaccinate, around the advantages of having a vaccine. And it also, in an ironic manner, it does help to see that, in fact, some people have lost their lives to COVID-19. And there is an avenue that can be used to protect yourself against dying from COVID-19. And this then provides a message in its own way. If we can see what used to happen in the beginning, even with COVID-19 itself, the adherence to non-pharmaceutical interventions was not as rife as it came after people realized that COVID is real and COVID can take your life. And that alone drives a message on its own. However, we do make a concerted effort to then get to the media, the social media, to communicate where we can find the young people. And the department has already provided quite a number of avenues and media to provide this information. You also find that on Twitter there is a lot of information that is coming through from the department on the issues of the vaccine and the vaccine rollout.
Let's leave it there for tonight. Dr. Sibongile Zungu, the acting Gauteng Health HOD.